Thanks for joining us again today. I'll start with the usual report of the daily COVID statistics. The total number of positive cases reported yesterday was 1,456. I would point out that this includes some catch-up of test results delayed over the past few days, which you'll recall I spoke about yesterday. The number today represents 19.9% of people newly tested and 11.4% of the total number of tests that were carried out. And again, you'll recall me explaining yesterday the different and we think more accurate approach that we're now taking to calculating this positivity percentage. I will continue to report both the old and the new measures this week, but from next week I'll report only the new one, which is the latter of the two figures I gave today, 11.4%. 500 of the new cases are in Greater Glasgow and Clyde, 393 in Lanarkshire, 198 in Lothian and 116 in Ayrshire and Arran. The remaining cases are across 9 other health board areas. The Western Isles was the only health board area not to report a new case yesterday, although Orkney and Shetland only have one each reported today. The total number of cases in Scotland then since the start of the pandemic is now 49,164. I can also confirm that 824 people are in hospital currently, which is an increase of 70 from yesterday, and 69 people are in intensive care, which is 8 more than the figure reported yesterday. I also regret to say that in the past 24 hours, 15 additional deaths have been registered of a patient who first tested positive over the previous 28 days, and that takes the total number of deaths under that measure to 2,625. And of course, that reminds us of the devastating impact that this virus is continuing to have on families across the country. And I want again to convey my condolences, I'm sure on behalf of everybody, to everyone who has lost a loved one, and in particular to those who have been bereaved in recent days. I'm joined today by the Social Security Secretary, Shirley-Anne Somerville, and also by the National Clinical Director, Jason Leitch. Shirley-Anne is going to talk in a moment about funding for free school meals and also about additional support through the pandemic for people who are financially insecure. And Jason will stress the importance of self-isolation and of getting a test as soon as you experience any of the symptoms of COVID. That's a hugely important point, and because it's so important, it's one that I also want to emphasise to you today. If you have symptoms of COVID, you might be tempted to wait for a day or two to see if those symptoms turn out to be nothing. In a way, that's natural. It's what we often tend to do with other illnesses. I know it's what I usually tend to do. But it's important that we don't do that right now with COVID, because this virus is different, and that's why we want and need you to come forward for a test as soon as you have any of the symptoms. So even if you're not sure that your symptoms necessarily mean you have the virus, err on the side of caution and come forward straight away. And that's important because it means that you will know as quickly as possible whether you've got COVID or not. And if you don't have it, then you can stop self-isolating. But also it's important because it helps to ensure that Test and Protect begins the contact tracing process as quickly as it can. When Test and Protect traces your contacts, if you test positive, they are often tracing the places you've been and the people that you have seen in the 48 hours before you started to feel your symptoms, because that's when it is deemed that you are at your most infectious. So any delay in going for a test and therefore any delay in finding out whether you are positive or not makes it harder for Test and Protect to reach these people and ask them to self-isolate before they potentially spread the virus on to other people. So if you have symptoms, and remember what these are, a fever, high temperature, a new continuous cough, or a loss of or change in your sense of taste or smell, then please self-isolate immediately and book a test straight away. Don't hang around to see if you feel better later in the day or the next day. Do it immediately. Now, I have 2 other things I want to briefly update on. The first relates to the £40 million of support we are making available to businesses affected by the current restrictions to hospitality. That support includes a £20 million grant fund, which is administered by local authorities. Local authority websites were updated this morning, and it is now possible for businesses to apply for grants, and they can do so at any time over the next 2 weeks. I would encourage all eligible businesses to apply by sticking to the new restrictions and either closing your business if you're in the Central Belt or operating it under restrictions if you're in the rest of the country. You're helping us to tackle COVID and helping us to stop it spreading so fast. And so it's really important that we help you to do that. So the grant fund is one way in which we are seeking to do exactly that. Now, I want to flag up as well just now that I will be saying more tomorrow about the hospitality restrictions, and I will be doing that after the Cabinet meets tomorrow morning to take stock of the situation and decide on our next steps. The second issue I want to briefly touch on today, which I've alluded to already this morning, is the latest position in relation to our testing figures. You'll recall that the number of new cases we reported on Sunday was artificially low because some test results took longer to come back than would normally be the case. That's because they had been diverted from the Glasgow Lighthouse Laboratory to other lighthouse laboratories across the UK. Now, we expect that virtually all weekend samples will have been reported by tomorrow. Indeed, many of them are in today's figures. So by that point, we should have a clear idea of the total number of new cases that have been identified in recent days. I mentioned yesterday briefly that I had also been made aware of an additional issue in recent days concerning how individuals are notified of their results through the UK-wide system. When tests are processed, results are often sent to individuals automatically by text message. Some results, I should say, are also sent by email, and there has been no suggestion of any issue with email notifications. But we understand that the system for text notification was slower than usual over the weekend. But I'm pleased to say that this issue now seems to have been resolved, and we're not currently aware of any backlogs. So individuals should be notified of their test results as soon as these test results have been processed. Now, we will continue to work with the UK Government on testing, and we will do anything and everything we can to help address any backlogs and other issues. That includes, of course, expanding NHS Scotland testing capacity, something which, as well as helping us to meet our own objectives for testing, will also help the UK's lighthouse network. Fundamentally, and this is a point I want to stress, I said it yesterday and it's important to underline it today, the testing system is working well, but we will continue to highlight and seek to resolve any delays or backlogs when they do occur. That's important for the vital work that Test and Protect is doing. And I would again stress the importance that you self-isolate when you until you get your result back. So as soon as you have symptoms and get tested, you should start to self-isolate as soon as you experience symptoms, and keep self-isolating until you get a negative test. Of course, if your test is positive, you have to complete your self-isolation. But that is the really important way to try to avoid passing the virus on to other people. Self-isolation is a key element of our rules and guidance. You can tell that because I've talked about it at length today. Jason is going to talk about it a bit more later on. But I want to close as usual by emphasising other key parts of what we're asking people to do right now to slow down the spread of the virus. For those who live in the 5 health board areas of Lothian, Lanarkshire, Forth Valley, Ayrshire and Arden and Greater Glasgow and Clyde, of course we're asking you not to travel outside your own health board area unless you really need to do so, and people elsewhere should not travel into these areas unless they need to do so. None of us anywhere in the country should be visiting each other's homes at the moment, except for very specific purposes, childcare or looking after a vulnerable person. That's a tough restriction, possibly the toughest of all of the restrictions, but it is a really important way in which we can help stop the virus jumping from one household to another. And when we do meet people from other households, outdoors or in places that are open, public indoor places like cafes, we should meet in groups of no more than 6 from a maximum of 2 households. In addition, only car share with people outside your household if it's essential. Work from home if you can, and if you're an employer, please facilitate your staff working from home wherever possible. Download the Protect Scotland app if you haven't already done so. And finally, remember to wear face coverings when you're out and about. The law now makes that mandatory in a number of indoor places, but wear a face covering whenever you're out and about. Avoid crowded places, clean your hands regularly and remember to clean hard surfaces because the virus can hang about on those. Keep 2 metres distance from people in other households because that also minimises the ability of the virus to jump from one person to another. And as I've been saying already, self-isolate and book a test immediately if you experience any of the symptoms. These are the ways in which all of us can play our part as individuals in trying to halt the spread of the virus. It helps to keep ourselves safe, avoid the risks of us contracting the virus. It helps to keep others safe because it minimises the risk of us passing it on to others. And of course, it helps to protect the NHS so that the NHS is capable and able to care for and treat all those who need its services. And ultimately, all of us doing all of these things helps to save lives. And I think we are being reminded today and at this time, as strongly as we were at an earlier stage of this pandemic, of that central objective to save as many lives as possible from this virus. So thank you for everything you're doing. I'll hand over now to Shirley-Anne and then Jason, and then we'll take questions as normal.
Thank you, First Minister. Whilst the pandemic remains first and foremost a public health emergency, we know that it is causing increasing financial pressure for many people. Some will have seen a sharp drop in their income from being put on furlough, having their work hours reduced or by being made redundant. Others may be simply finding that their money is no longer going as far as it used to. Moving into the winter period, with the colder weather, support being reduced through the Job Support Scheme, the impact of continuing restrictions to control the spread of coronavirus and the potential disruption of a no-deal exit from the EU, we know that some people may be worried about how to pay for essentials like food or fuel. That's why I'm announcing funding will be made available to local authorities to support people on low incomes. We will make over £10 million available to continue the delivery of free school meal provision for forthcoming holidays, including Christmas, the February break and Easter. Funding will also be made available to reimburse councils for the costs of provision delivered over the October holidays. This important investment will support around 156,000 children and young people, helping families meet the cost of meals over the school holidays. It will be for local authorities to decide how this support is delivered. However, we continue to advocate for a cash-first approach where appropriate, giving families the choice over what food they buy and where they buy it. We will also make £20 million available of funding to local councils to tackle financial insecurity. Councils will be given flexibility in how to use this funding to meet local need. It can include supplementary local budgets for Scottish Welfare Fund crisis grants and community grants to ensure that demand is met in full, further boosting local funding for discretionary housing payments as needed to help people meet their housing costs and helping people to meet fuel costs. There will also be assistance for people to meet the cost of food. This new investment is in addition to the £57.5 million already made available for the Scottish Welfare Fund and the investment in our new self-isolation support grant. I would encourage anyone who needs support to reach out to their local council for help. Our National Assistance Helpline available on 0800 111 4000 remains in place for anyone requiring support to access food and the essentials that they need. I would also encourage everyone to check that they are receiving the full support that they are entitled to from both the Scottish and the UK social security systems. Services like the Money Talk team, delivered by Citizens Advice, are available to help you identify and apply for the support you're entitled to through the social security systems. You can find out more at moneytalkteam.org.uk or phone for advice on 0800 085 7145. Whilst it is vital that we do all we can to help control the spread of coronavirus, we also remain committed to doing everything within our power to support people being affected by the pandemic. And this new additional investment announced today will ensure that people continue to receive the support that they need.
Thank you, Shirley-Anne and Jason.
Thank you, First Minister. I just want to briefly underline one of the points the First Minister made in opening. Test and Protect can only work if each of us play our part, particularly at the beginning of that process. Every week or so, the Scottish Government does polling with a sample of the broader Scottish community. One of the questions we asked this week and have been asking is If you had any of the coronavirus symptoms, which one, if any of the following, best describes what you would do? And it is about whether you would book a test and self-isolate. The first good news is that pretty much everybody knows the symptoms. And if they've watched this or watched any news programme in the last few months, I'm not entirely surprised. So that is excellent news, that people understand a new continuous cough, a fever, or a loss or change in taste or smell. 69% of people answer that they would self-isolate and book a test straight away. That is, of course, the correct answer. That's only 69% of people. 18% of people say they would self-isolate, but wait a day or two to see whether they would get better or get other symptoms before they book a test. That's not the right answer. That's the bit we would like to try and correct. So if you get any of these three symptoms, do not treat it like you used to treat the common cold or even the flu, where you would wait a little while whether you should go to work, whether you should send the kids to school. Just book a test. Self-isolate and book a test immediately. We have enough capacity to manage that. You do not have to wait. There are then small numbers of people who are more concerning. I would continue as normal for a day or two to see whether I would get better or get other symptoms before I book a test. 3%. Now that puts both you, your family and others in direct danger of virus transmission. So please do not do that. So let me underline it again. If you get one of the three symptoms, or a member of your family gets one of the three symptoms, maybe one of your children, please book a test and self-isolate immediately, and then Test and Protect can then do its job by communicating with you, your contacts, and self-isolating them. Thank you, First Minister.
Thanks, Jason. We'll move to questions now. Jamie McIver from the BBC.
Hello, good afternoon, First Minister. There's intense speculation today surrounding the possibility of school closures. Now, I know you've got no crystal ball, but how likely do you think widespread school closures are within the next few weeks? What's your message to parents? And given the justification for some of the other measures in recent weeks has been that keeping schools open is a top priority, how damaging might widespread closures be to your strategy?
Thanks, Jamie, and thanks for recognising that I don't have a crystal ball, and I've tried to be very careful about absolutely definitively ruling anything in or out, given the inherently unpredictable nature of the situation we're dealing with. But I will do everything, and the Scottish Government will do everything in our power to avoid widespread school closures again. We want to keep schools open as far as is possible. And we want to try to do that regardless of what other levels of intervention we might be deploying across the country. Now, I recognise as the virus spreads more, and we're trying to avoid that, we're trying to slow it down right now, and as we moved up a scale of intervention, then some of these discussions in local areas become more important to decide whether schools remain open absolutely as normal full-time, or whether there would be any argument for a move to blended learning for some or all of the school. So I can't rule that out, but we want to do everything in our power to keep schools open. And that is, in all of this, dealing with a pandemic like this, there's lots of priorities because all sorts of things are important. Sometimes these priorities feel as if they're competing. But if I had to single out one thing right now, in addition, of course, to saving lives, which is the top priority, keeping young people in education is right up there, because we know the damage that is done to kids' education, but also to their well-being, their overall sense of well-being and mental health from being outside of school. So I can't emphasise enough how important that priority is to us. Just by way of, and obviously we are Scotland and we have to take our own decisions in our own context, but just as an illustration of the fact that other countries in many cases are trying to fulfil that same priority. Yesterday, the Republic of Ireland moved to the very top level of its tiered approach to intervention. Not quite back to a full-scale lockdown, but much closer to it than they have been, and much closer to it than Scotland is right now. And they have said that notwithstanding that, they intend to keep schools open. So keeping young people in education, I just can't stress how important it is, albeit that I don't have a crystal ball, and I've got to say to people, frankly, that of course we have to keep all sorts of things under review, but I want to see schools open as normally as possible, as far as possible, no matter what other restrictions we might or might not be putting in place. Gordon Cree from STV.
Thank you. This afternoon, you're meeting with the other party leaders to talk about the planned introduction of the tiered system of restrictions. People will wonder that when that comes into place in the short term, are most of us likely to see much the same restrictions as we have now, or something less or more? And can I ask Professor Leitch two things? One, I'm sure you spend a lot of time looking at the data of these things, and it's probably easy to read into it whatever you wish, but it appears on some readings that in terms of cases and the trend of cases, it maybe peaked towards the middle to end of last week. I wonder if you share that view. And also, we're hearing a lot at the moment about intensive care unit occupancy. Do you know how that compares to where you would expect to normally be at this time of year?
I'll hand over to Jason in a second, who I know will be prepared to talk to you a little bit about what we think the data is telling us currently, because we had a fairly in-depth session about that earlier this morning. The one caveat, just to immediately put on that, is we know over the weekend we've had a little bit of a lag in our test results coming back, so that will mean that our data for the last few days is not quite as comprehensive as we want it to be, so there'll be a caveat in that. But I'll let Jason go into that in a bit more detail. I think we've got some, if Jason doesn't have them, I think I've got some rough ICU figures I can share with you as well. On your question to me, so I'm meeting party leaders this afternoon. Deputy First Minister is having a similar engagement exercise later this afternoon with the political leadership of COSLA to share our up-to-date thinking on the new tiered or levels approach that we intend to introduce. Let me just very briefly, and I'll probably say a bit more about this tomorrow, but we intend to publish a draft strategic document later this week, probably Thursday or Friday. We've not finally decided that, although I'll confirm that hopefully tomorrow. That strategic document framework will look at a range of different things. Our review of the testing system, for example, business support that we want to make available for future phases of the pandemic. But at its heart, it will have this new approach to tiered levels of intervention. We intend to give Parliament the opportunity next week to debate and vote on that overall framework with a view, if Parliament approves it, that overall framework coming into effect at the start of the following week, which would be the 2nd of November. That also aligns with the start of the new furlough scheme, which, as you know, doesn't go as far as we would like it to go, but nevertheless aligns there. What that means is over the course of next week, we will be assessing the up-to-date data and deciding whether all of the country would go into a certain level of the new framework, or whether parts of the country would go into one level and other parts of the country into another. And as part of that, we will be considering, of course, whether there are parts of the country that need tougher restrictions than those in place in the central belt right now, or whether there are parts of the country that might be able to have less tough restrictions because their case numbers are not as high. We need to assess that on the basis of the up-to-date data, which we will do over the course of next week, with a view to those levels applying, assuming Parliament approves the broad framework at the start of the following week. And of course, we'll do lots of discussion and consultation with local authorities and others in the intervening period. The other issue which falls to be decided a bit more quickly is the current restrictions and whether they will continue to apply between now and that new framework coming into place. And that's what Cabinet, and by those I mean the restrictions on hospitality that were put in place about 10 days ago, and whether we will roll them forward for that intervening period. And Cabinet will discuss and decide that tomorrow morning, and I, all being well, will update you on our decision at 12:15 tomorrow. So I hope that's clear, well, as clear as these things can be. What we are hoping to do is get to a system here where there is much more clarity. If the virus is pretty much under control, then here's the level of restrictions people can expect to live with, bearing in mind that there's no absolute normality this side of a vaccine or much more effective treatment probably. But if the virus is running a bit less, a bit more out of control or closer to out of control, there will be a higher level of restriction, and there's clarity of what that will be. obviously keeping some degree of ability to be flexible, which we always have to do in the face of a virus. But I'll be saying more about this over the course of this week and, of course, into next week as these decisions fall to be taken. Jason.
It's difficult, Gordon, as you would predict, to be completely definitive, to show causation, but it would appear that 11 days into the restrictions in the Central Belt, that the doubling time is not as it was. So you'll remember 2 weeks ago we stood here and said the doubling time modelling suggested 9 to 11 days. Well, we haven't gone from 1,400 positive cases to 2,800 positive cases. That would have been doubling. So it would appear that we have blunted the acceleration, but I don't think I can say, as you suggested, that it has peaked. We simply don't know. That is made slightly more complex by the weekend delays and the challenges with the data from Saturday and Sunday and the date of testing. We're hoping that will catch up this week and that will play into the decision making that the First Minister has just described once we know that data with more granularity and certainty. But I think people can be reassured that the sacrifices they are presently making are worth it. And they will serve us well going forward. But I cannot tell them that those sacrifices are over, clearly. To your second point about intensive care, at the peak in April, we had 200 positive COVID cases in intensive care. And last night, we had 69 patients in intensive care with COVID. Now, remember, these are the very high level, very sick people. And mortality is very high in that group. So we want none. We've got 69 and we had 8 new admissions yesterday. So this is the other side of the coin about the data perhaps being encouraging. This is less encouraging. So overall, across all of Scotland's intensive care units, we had 171 people in intensive care, including those 69 with COVID. We can double intensive care pretty quickly if we need to 360, and then we can treble it to 585 within a fortnight if we need it. We don't want to need it, of course. Probably the hardest data is that we've had 48 new ICU admissions in the week to the 19th of October. And that is exactly what we said would happen when we saw the big numbers over the last few weeks. And that's why we've made these restrictions. Intensive care can manage those numbers, but families, patients, carers, of course, have to suffer what that means.
And the one point always to remember about data for hospital admissions and ICU admissions is that they are lag data. So somebody going into hospital is likely to be somebody who was first infected maybe 10 days, 2 weeks ago, and slightly longer for somebody going into ICU. So what we need to look at to know what's happening more recently are the new cases and the percentage positive, which Jason has touched on, and we will be looking at very closely in the days to come. Claire McNeill from ITV Border.
Thank you, First Minister. First Minister, in Dumfries and Galloway, coronavirus cases are rising quite rapidly by the day. Are you concerned at all about the virus getting out of control there? Are you considering increasing restrictions there, as has been done in the past when cases were rising? Or can you indicate kind of what level of prevalence it would take before you consider that? And are you speaking to local leaders in Dumfries and Galloway about how things are going there and what steps they might want to take locally to control the rise?
Thanks, Claire, and I'll maybe ask Jason to contribute here as well. As we look, and as I said earlier, we had a session of myself and other ministers with senior advisors this morning to look at the picture across the country and the picture in different parts of the country. And the Central Belt, the areas under most severe restrictions, certainly give us the greatest cause for concern right now. But there are other parts of the country where we see quite a not insignificant increase, in Dumfries and Galloway is one of those areas. You're right about that. Parts of Tayside would be another area that we would put into that category. So as we go through the process I've just outlined to Gordon, in terms of the decisions we will take for the new tiered system, these will be very much issues under consideration. And of course we will have discussions with local leadership, whether in Dumfries and Galloway or elsewhere, about the decisions that we think the data is driving us towards. So that will be very much something that is in our under consideration over the next week or so. Previously, remember when we had restrictions in Dumfries and Galloway, it was for a very localised outbreak around Gretna and Annan. What we have in many parts of the country right now is much more widespread community transmission, which needs a different approach than very localised outbreaks. But yes, we will be considering these things over the course of the next week. But I'll ask Jason to supplement.
There are layers of decision making inside these processes, as you would imagine. So the local incident management teams, the local public health leaders in Dumfries and Galloway, with their local authority colleagues, discuss the nature of the cases there, whether that's specifically outbreaks that are still bad but manageable, perhaps in a care home or perhaps in a hospital or in a workplace. And you've seen us respond to that in Dumfries and Galloway previously, rather than the broader challenge we have across the Central Belt just now, where it is not specific small outbreaks. It is much more widespread. You can, if you go online, see your own area in the COVID-19 dashboard for Scotland now, and you can begin to see some leakage of the Central Belt into the other health boards, Tayside, as the First Minister mentioned, and Dumfries and Galloway. So we are keeping a very, very close eye on Dumfries and Galloway and every health board and every local authority area, and we'll continue to do that over the next few days.
Thanks. What Jason's just said there about the data that's available for anybody to go and look at on the Public Health Scotland website, you can go into your own neighbourhood, and by that we mean a neighbourhood of around 4,000 people, and see the number of cases in your area. It's a really good resource. If you haven't looked at it yet, I would encourage you to do so. Ali McGilvery from Bauer. Is Ali with us? I'm going to move on, then I'll come back to see if Ali has managed to connect in a moment, but I'm going to move on just now to Shona Duthie from Original 106.
Thank you, First Minister. We're continuing to see hundreds of new cases in Glasgow and Lanarkshire areas every day, several weeks after local measures were introduced. People here in the North East face travel restrictions after a very small number of cases in comparison during their local lockdown in August. Can you explain why formal travel restrictions were deemed necessary in that outbreak, but people in the Central Belt aren't facing any formal travel restrictions at the moment? And secondly, we've been speaking to gym owners and they're concerned about the effect of people's physical and mental health if they have to close again as we head into winter. Under the tiered system, is there a chance you will look to protect certain businesses like gyms and fitness centres?
On travel, we are asking people in the areas under the toughest restrictions right now not to travel outside their area, and for people in the rest of Scotland not to travel into these areas. And we try to keep travel. We have right through certainly the latter stages of the pandemic tried to keep that on a guidance basis because of enforcement challenges. But of course, as I was talking about last week, we are considering in the next phase whether to apply a more regulated approach to travel where restrictions apply. We're at a different stage in the pandemic right now, so not everything we do will be the same as we did earlier on, but the same general principles apply here as applied to Aberdeen previously. And of course, as we've just been talking about, while we do see some signs for very cautious optimism in the some of the Central Belt figures, it is too early to really know what effect those restrictions are having, just as it took, as you will recall, Shona, it took us quite a while to know exactly what the effect of the restrictions in Aberdeen were. But what happened in Aberdeen was that what could have been an outbreak that ran very, very dangerously out of control was brought back under control because of those restrictions. And on your point about gyms, look, we will try to keep everything open as far as we possibly can. I've already talked about schools, which, obviously children's safety is paramount, but children being in education is paramount. And we understand the mental and physical health benefits of people being able to go to gyms. So in the Central Belt right now, group exercise in gyms is not allowed because of the heavier restrictions, but we have said that gyms can remain open for individual exercise. So we try to accommodate as much normal life as possible, but I can't stand here, given what we're dealing with, and be absolutely definitive about, X type of business will never ever have to close again. All I can say is that we will try to manage this virus in a way that keeps as much open as normally as possible for as long as possible. And that will guide us through all of the decisions we have to take. I'll have another go to see if Ali from Bauer is with us.
Hello, First Minister. Can you hear me now?
Yep.
Perfect, thank you. Apologies for that. Radio Borders has been speaking to a Kelso hotelier who says the hardship fund, which opened this morning, won't even pay his monthly gas bill. Now, there were only 5 new coronavirus cases in the region yesterday, and he feels the government response has been disproportionate for this region. Are you able to respond to that? And can you say what more support may be offered to businesses? You touched upon earlier the tiered system. I'm just wondering if there's more support for those who might need to isolate while allowing those who can to get back to work.
Look, the reason we're moving to a tiered approach is to try to be as proportionate as possible, so that where one part of the country really needs tough restrictions, but another part doesn't, we can have that tailored approach and not have to have a one-size-fits-all. Now, on the other side of that, that brings more challenges around communication, but I think it's important to be as proportionate as possible. The other point I would make, and I've made it before, is it is often important to act in an early way and in an early intervention manner in order to try to stop cases running out of control, because it is with this virus, and we've all seen this, it doesn't take long for one case to become 5 cases, to become 10 cases, to become 100 cases. So often we will do things on a preventative basis, which for the longer term for businesses, I would argue, is better than allowing things to get out of control and then having to act in a reactive way. On the business support, we've put in place for the current hospitality restrictions, and this will continue to be our approach, as much business support for businesses that are having to close or their operations are restricted as we can within our resources. I mentioned earlier on the replaced furlough scheme. We continue to try to persuade the UK government that in terms of the subsidy for wages of people who can't work because their business that employs them might be closed or restricted, that doesn't go far enough, and there are other leaders across England and Manchester, for example, making that same case to the government. So we will continue to make that case to the UK government, and we will continue to argue for the UK government to take decisions that allow a greater flow of consequential funding to come to devolved administrations, so that we would have the option of increasing the level of support we can give to businesses. But I know how tough this is for businesses. Some of the decisions we have to take are just inescapable. We maximise what we can do to mitigate the financial impact of that for businesses, but I have to be frank with people about the outer limits within our budget of what we can and can't do. And in terms of the level of grants that we're making available, it is at the outer edge of what we are able to do without additional sources of money, which, as I say, we continue to argue for, but can allocate if we don't have them. And I'm afraid that's the position that we are in, but we will continue to try to treat businesses not just as fairly as possible, but mitigate the impact on them as far as we possibly can. Neil Pooran from PA.
Thanks, First Minister. In terms of the financial support that's available to people, has there been any discussion around bringing the payment date for the new Scottish Child Payment benefit forward? I think the first payments are due next year. And also on the £500 grant that's available for people self-isolating, I was wondering if maybe the Social Security Secretary could update us on the uptake of that. Do we have any figures on how many people are actually using it?
hand over to Shirley-Anne on both those points. I think we are doing as much as we can with the child payment, and what we've tried to do there is minimise the delay. And actually, given the months that we've had coronavirus, I think we've managed to squeeze the delay in the child payment to probably as short a period of time as possible. But I'll ask Shirley-Anne to go into more detail.
Thanks. The First Minister is correct. We have endeavoured to make the Scottish Child Payment our priority as we've moved forward during this pandemic for the social security system. And the fact that we are able to open for applications in November with the first payments being made in February is as fast as this could possibly go. Now, the important thing as well, however, is that that doesn't mean that we're doing nothing in the meantime. Of course, there's been not just the funding that I've announced today, but the funding that was announced much earlier on in the pandemic by Eileen Campbell for the £350 million support, which included aspects like food insecurity, fuel support and so on as well. So we've taken a lot of steps already to ensure that we're supporting people through these difficult times. We're continuing to do so, and the absolute priority within the social security system has been the safe delivery of the Scottish Child Payment, a brand new payment, of course, of £10 per week for each eligible child. And that's something which we will do only 2 months later than we had originally planned before the pandemic started. On the aspects around the figures that you mentioned for the self-isolation support grant, we know that calls are coming through on that. We're collating that information from the local authorities, and once that's in a fit state to be able to publish, we'll of course make sure that people are aware of that, to continue to ensure that we keep a very close eye on that, so that we know that people are aware of the scheme and that people are actually making use of it as well, and we'll publish that data as soon as we can.
Thanks. Chris Musson from The Sun.
Good afternoon, everyone. Can I check on the tier system? Will the Scottish Parliament be able to amend the plans for the tier framework, or will MSP simply be given an opportunity to approve or reject? And also, just on Professor Leitch's comments just now, that the current restrictions appear to have blunted the acceleration of virus cases. What's the evidence that the current restrictions are the cause of this apparent blunting and not other factors? Could there be other confounding variables here?
If only we could answer that question absolutely categorically, we'd probably all find things a lot easier, but I'll let Jason have a go. On your first question, Chris, which is a good question, obviously, as you know, it's not entirely within the gift of the government how a parliamentary debate is structured and how a vote is structured. We will put forward a motion. Opposition parties will be able to put forward amendments, and we'll have some discussions between now and then about exactly that. What I would hope, and you know, it's part of the reason I'm having an initial discussion with the party leaders this afternoon, and happy to have discussions later in the week, is that we can come to a reasonable degree of cross-party consensus about it ahead of that debate, and in publishing the outline framework later this week, I would also intend to then have a few days where there could be comments made on that, and we might tweak it ahead of the parliamentary debate to take account of any obvious points that people wanted to be rectified. So we'll try to build as much consensus around it as possible. It will be a framework, and it's important we get it as right as possible. It's equally important, given what we're dealing with, we don't become an absolute prisoner of any framework, because we need to retain a degree of flexibility. But it's also important we recognise that applying that framework is where the really difficult decisions will lie. And you know, ultimately, government has to take those decisions, and the buck has to stop with us for those decisions. But in taking those decisions and applying the framework to the country or parts of the country, we will also try to build as much consensus as possible through discussions with local authorities and with parties within the Parliament. Jason.
The global COVID literature expands every single day by hundreds and hundreds of articles. We don't know definitive answers to lots of questions about this virus or how it behaves. We do know some things, though. We know that what they call in the literature non-pharmaceutical interventions, NPIs, non-pharmaceutical interventions, so not drugs, are our best defence. There isn't an unrestricted country in the world. Every country, the public health advice has been to restrict human contact. It's horrible to have to say it, but it is the only thing that presently works to drive down the prevalence, whether you're in Sweden, New Zealand, or Scotland. Now, when you do those NPIs, you have to make choices about restricting travel in and out of your country, like New Zealand, voluntary versus mandatory, like Sweden, like Scotland. So you make choices about which NPIs you will use, but they are all designed to reduce human transmission from one to the other. And we know they work for coronaviruses. We've known that for decades. We know they work for this coronavirus in the last few months. But there are confounders everywhere, Chris. You're absolutely right. So human behaviour is one element. The virus changing would be a confounder, but there's no evidence that the virus is changing in any meaningful way to, for instance, make it less virulent. I wish it were, and that may well one day happen, but it's not happening yet. But we keep a very, very close eye, as much as we can, on what our interventions do to transmission. But some of that is unknown.
One of the things, correct me if I'm wrong here, is that we have some early indication of, since we introduced the household restrictions is that people's average number of contacts, and we know this through Test and Protect, is reducing, which would be a positive indicator of exactly the effect Jason is describing.
So we know it from two sources. We know it from the positive cases, which is the Test and Protect data, but we also know it from polling data. So we ask people, how many people have you seen this week? How many contacts have you had? Now, in non-COVID times, the public health community tell me that actual contacts is between 20 and 30 a day. 20 and 30 people who you come into close contact with before COVID, if you can remember such a period. Now we're in low single figures, and many people working from home, only meeting their own family, not in other houses, are in very, very low numbers. So we know that bit is working, and we know from what we know of coronaviruses that will reduce transmission.
And that number had obviously reduced dramatically during strict lockdown. As we came out of lockdown, that started to go up again. And since we've introduced these restrictions, it has started to come down again. Not to quite as low a level as during strict lockdown, but it has reduced again, which would be something that would give us not absolute proof of causation between our interventions and any levelling off, which we're still very cautious about, but would give us an indication that that was having an effect. But so too will people washing their hands, so too will face coverings, so too will all the other things that we're asking people to do. It will be a basket of these things. If we are seeing any positive direction of travel here, it will be a basket of all of these things that are leading to it.
And there's a lag, as you described earlier. So the infection you get today doesn't put you in hospital for another 2 weeks. So the hospital admissions today are infections that happened before the most recent set of restrictions.
Can I just check on that then? This blunting is perhaps due to not just this past fortnight's restrictions, but also the rule of six, which has obviously been in place for slightly longer.
And the household restrictions nationally, which have been in place for 5-6 weeks now. So you're absolutely right, Chris. And I wish we could do something, wait 3 weeks and then do something else. But the virus doesn't let you do that because people are suffering and dying from it today. So sometimes you have to layer restrictions on top of each other, which is the nature of a global pandemic, I'm afraid.
But the intervention that we have made most recently is the one that is least likely to be showing through in our figures yet, just because of the issue of time. So the hospitality restrictions will not yet be fully feeding through, whereas I think it was it the 25th of September or thereabouts we introduced the restriction on household interaction. We would hope that is now having an impact. And you're right, the previous rule of six, or 6-2 in Scotland, would also be hopefully feeding through into that. But we've almost turned this into a seminar, the answer to your question, Chris, but going back to my starting point, it is just not possible, probably without the benefits of genomic sequencing, to be absolutely exact about what interventions lead to what. We just know in general terms what works and what we need to do more of in order to have the impact that we are all trying to get. So the long and short of it is if everybody needs to abide by all of these restrictions, including the hand washing and the face coverings, to hopefully continue having an impact that drives things down. Right, can we move on? Probably from one questioner who leads to a seminar to another who may lead to a seminar. Mark McLaughlin from The Times.
Good afternoon, First Minister. Political question for you and then a technical one for Professor Leitch. This morning, DV Sridhar suggested COVID hotels. We know that transmission happens most in the home, but we have almost come to accept the fact that if somebody gets COVID, they just have to go home and infect their whole family. She suggested we have a hotel where people can go and either, recover and in quarantine or be monitored if they have to go to hospital. It sounds extreme, but we've already co-opted hotels for the homeless and asylum seekers during this, so it might not be a massive leap. Has Ms. Sridhar discussed this with you at the COVID-19 advisory group, and what was your view? And then one for Jason. You mentioned about mutations there. Have you looked into this apparent mutation in Norway? They're talking about some kind of super strain of coronavirus. We've had these scares in the past. Is this one credible?
Thanks. I'll hand over to Jason in a second. I've not seen the particular comments of Davies that you're referring to, so I don't know exactly what circumstances she would be suggesting, to use your terminology there, COVID hotels. And given that I do have the privilege of being able to speak to her directly, it's something I would probably want to speak to her directly about. I've certainly not had that conversation with her personally. I can't say for sure whether it's something that has been discussed in any way, shape or form through the advisory group. I don't know that, but that's probably as far as I should go without having seen exactly what she has said and what context she's talking about. Certainly, you know, in some other countries, correct me if I'm wrong, Jason, but New Zealand, Australia, they use quarantine hotels for incoming travellers. So it's not a requirement in those countries to do what we ask people to do here, which is quarantine, you know, wherever they might be going. They are actually made to stay in a hotel for 2 weeks. I am not sure, and that's not to say it doesn't happen, I'm just not familiar with it, countries that actually take their own citizens who are positive and put them into hotels as opposed to allowing them to recover at home. But I will certainly make a point of looking at Davies' comments and talking to her direct.
I don't know any country that does that except China. China did it at the beginning. I'm not sure what they do now. In answer to your mutation point, Mark, there is still no WHO authorised global evidence of a mutation in either a good direction or a poor direction. Viruses mutate for two reasons. They mutate for virulence, so the sickness you would get from it, and they mutate for transmissibility, your ability to move it from person to person. So what we want is low virulence. We're not quite so worried about transmission. So if we could get a virus that wasn't as harmful, we wouldn't mind so much about its transmission, like the common cold. Very, very easy to transmit, but doesn't kill you. So what we would like the virus to do is that, so become less virulent, and that would really help us. There's no evidence of it going that way, or as the Norwegian thing suggests, that it's getting super nasty and it's going to kill people even more. There's no coherent evidence yet, but genomics works in every country, in every developed country in the world, looking at every single virus strain. So people are paying a lot of attention, but we don't have any evidence for it yet.
Conor Matchett from the Scotsman.
Thank you, First Minister. Going on from Chris's question about the evidence that exists and that sort of thing, we've often asked you in the past about why you're going to make restrictions. I'm wondering, given the necessity for speed of response in these sorts of situations, what has stopped you over the last couple of weeks of introducing further restrictions sooner than the introduction of the strategic framework in a couple of weeks? And Professor Leitch, if I may as well, I'm just wondering of your thoughts on something that I've read a couple of times about over dispersion and that phenomenon, and backward contact tracing, and how much of those types of things are informing policy within test and trace at the moment in Scotland.
I'll take the part for me. You're right, we're often asked why we do certain things. I think Jason just gave a very cogent explanation of what it is we need to do: reduce human interaction, and therefore the interventions we use are the things that we judge are most likely to do that. So asking people not to go into each other's houses, and more recently restricting quite substantially hospitality. In answer to the second part of your question, to me, why haven't we gone further yet? Don't underestimate, and I know the virus moves quickly. Often our consideration of these things in a public commentary sense moves quickly as well. What we introduced 10 days ago was pretty substantial in terms of shutting down hospitality pretty much completely in the Central Belt and heavily restricting it elsewhere in the country. And, if you cast your mind back, that was not something that people just shrugged their shoulders and accept. There was a lot of, angst and controversy, understandably, in particular within the hospitality sector. So I think there is a tendency for big restrictions to be introduced. Everybody go, oh my goodness, and then a few days pass and everybody forgets how significant those restrictions were. So we have very, very significant restrictions in place across the country, nationwide, and we were the first part of the UK to do this. We're asking people to stay out of others' houses, and across a significant chunk of the country, hospitality is pretty much closed. That is pretty substantial. Is it as far as we will have to go? particularly in the Central Belt. Right now, I cannot say that categorically. I hope it's as far as we will have to go, but we will be considering the data into next week as we go into the levels approach and making judgments and decisions on the basis of that. But I wouldn't want anybody to really underplay just how significant the restrictions we already have in place are. But if we need to go further in the interest of protecting life, we will do that, and we will try to mitigate the impact of that, because everything like this has an impact on other parts of life as far as we possibly can.
Conor, I'll do your backwards tracing point in a minute. Say more about your over-dispersion point. Do you mean the K number, the number of super spreader type events?
Yes, exactly, yeah.
Okay, so in public health terms, two numbers are very, well, hundreds of numbers are important, but two numbers for transmission are important. R, which we've talked about a lot, which is the average number of people you give it to if you have it across the whole population. The K number is a way of trying to describe individual outbreaks. So let's take the South Korean church. The South Korean church a few months ago that gave the virus effectively to thousands of people on one Sunday. That increases your K number, but doesn't do much for your R number. Well, the tricky bit there is they're very difficult to restrict. So the K number doesn't help you with intervention quite as much as the R number helps you with population prevalence reduction. The K number can help you if, for instance, you have a chicken processing plant and you have a meat packing plant in Germany, and you suddenly realise globally that cold processing, food processing, is a problem, and you can start to do things. And you've seen us do that from Wales to Scotland to around the world. So the K number helps you with that. It helps you with care homes, helps you with where you have high-risk individuals. But it doesn't help you quite so much with population-level measures. There is a suggestion in some slightly quirky literature that you should only care about that, and therefore you can ignore the population measures. That is not mainstream public health science. That is dangerous. Your backwards tracing point is good. Backwards tracing is much, much harder than forwards tracing to find the contacts. Backwards tracing really needs genetics. That's both expensive, time-consuming, needs a lot of people. We do that. That's how we know when we published a few months ago 120, 130 access points to Scotland in February, March, April for the virus. We're going to get new genomics this week for Gregor and I to look at what the latest pattern of that will be. And that backwards tracing lets you know something about where the virus came from and something about where the virus potentially was transmitted. But it's not always quite as reliable as, yes, it was that pub, yes, it was that house. But it does give us themes on which we can then base the advice.
Thanks. Callum Ross from the Press and Journal.
Thanks, First Minister. Concerns have been raised about a new fire safety standard that was due to be introduced in February for all households. Douglas Ross has said it should be put back until 2022 due to the pandemic and the practicalities involved for house owners. And I think the Scottish Government has indicated as well that it is considering a delay. I just wonder if you had any further update on that, how long it might be delayed and when an announcement might be made.
We are considering, Kevin Stewart, the Housing Minister, is considering that as of now, and I think there is a strong case to be made for a delay of a year, given the practical issues with the pandemic, of people doing what is required to meet with that standard. And once Kevin's had the opportunity, Shirley-Anne may want to say a bit more or not about this, but we'll make an announcement confirming that decision as soon as possible. But I know I've had quite a few emails about it, because I think people have been getting leaflets from companies about it, which has sparked a bit of concern. But we will make the outcome of that process of consideration known hopefully very soon.
Just to further say that we're absolutely aware of the concerns that are out there about that. Kevin Stewart is looking at this and is very keen to be able to reassure people about this, and we would expect him to do that soon.
Georgina Hayes from The Telegraph.
Good afternoon, First Minister. Latest data from Public Health Scotland shows that referrals to child and adolescent mental health services have more than halved since the start of the pandemic, and almost 40% of young people are waiting more than 18 weeks to get treatment. Obviously, the Scottish Government target is that 90% of young people get treatment within that time. And the Scottish Government has recently published its recovery plan for mental health for young people, I think mental health in general. But experts have raised concerns that this doesn't really address the most serious issues facing mental health care for young people, especially around specialised services and the lack of psychiatrists available to young people. So can you commit to ensuring that there is greater funding going directly to CAMHS and the recruitment and training of psychiatrists? And also, do you have a message for young people currently trying to get help that can't?
I'll come back to that important bit in a second. It's a really important question. I'm not obviously aware of the particular expert comments that you're raising there, but I know the Mental Health Minister will want to be engaging with experts in mental health to make sure that the recovery plan is addressing the issues that across the mental health community it is believed are necessary. What we are trying to do, and this predates COVID, but it is obviously made all the more important because of COVID, is not just invest significantly in CAMHS, which we are doing, and the workforce in CAMHS has increased in recent years, but also redesign the children and adolescent mental health service landscape to put more of an emphasis on early intervention and prevention. So we're establishing a national wellbeing service. We have invested in counsellors across schools so that fewer young people end up being referred into specialist services because they haven't got the earlier help and treatment that might have prevented that escalation to specialist services. Of course, there will always be a number of young people who do need specialist services, but making sure those who can better be treated through earlier intervention also will help us speed up the time it takes for those who really need specialist care to get that specialist care. That's work that was underway before the pandemic and will accelerate. There has been, as there has been across so many different areas, a reduction in face-to-face consultations and treatments across the NHS, and that has had an impact on mental health, including children and adolescent mental health. Some health boards I know have worked to try to use that time to address some of the longest waits, but we need to make sure that for everybody who needs access to CAMHS, that is as short a journey as possible, and we're very focused on that. I mean, finally, my message to young people is, at any time, making sure that any young person that is struggling with their mental health gets access to the early intervention, the help, the advice, and where necessary, the specialist treatment they need is a priority. But young people across the country, across the world, have undergone an experience in the last few months and are still undergoing it in many respects that none of us in previous generations can even begin to imagine. Disruption to schooling, not being able to see your family, your grandparents or wider family, being cut off from your friends, just the general anxiety of living through a global pandemic. And we understand that that will have exacerbated the mental health struggles of many young people, but also meant that many young people who might not have struggled with their mental health will do in future. And the Mental Health Minister and the government generally is very seized of that necessity and imperative to make sure that the services and treatment are there, and it's something we're very focused on. We will, earlier in the pandemic, we had a consultant psychiatrist here with us at one of these briefings to talk specifically about the mental health impacts of the pandemic. I think as a result of your question, we will probably think about doing that again and with the Mental Health Minister herself, just to have a focus at one of these briefings on mental health generally and in particular as it affects young people, children and adolescents. But thanks for your question, it's an important one. Tom Gordon from the Herald.
Hello there, First Minister. Can I just check something about tomorrow's Cabinet meeting? You said would discuss whether to extend the current restrictions in the Central Belt for 1 week until the new system kicks in. Can you just give us a broad idea of what to expect? Because it does seem common sense for these to be rolled forward rather than having more than 3 million people zigzagging between different systems. And on the vote in Parliament next week, will MSPs know which tier or level applies to their area before they vote on it?
I think, Tom, hopefully this answer will be helpful without me preempting cabinet discussions and decisions, which I shouldn't do. But I think in a sense, in the way you articulated the question, you probably provided your answer in terms of a general direction of travel. I think if you look at the numbers across the Central Belt right now, if you look at the sequencing over the next week of moving to a new system, then you might expect that it would make sense, not just from the sequencing point of view, but from a public health point of view, to see that rolled over. That is one option that Cabinet will be looking at tomorrow, but of course the regulations currently expire on Monday, so it will be another option for that to be allowed to happen. But we will look at the data that Jason and others will provide to us, and I will give the outcome of that here tomorrow. Obviously, I want to have a discussion with party leaders about the content and the substance of what we're working through just now, but also the process of decision. And therefore, I don't want to be definitive before I've had the opportunity to do that. I think it's really important that Parliament decides on the framework. I think we will get ourselves into probably too laborious, that's not the right word because I don't mean to make parliamentary democracy sound laborious, but given the speed at which governments have to act, I think for Parliament to be taking decisions on which parts of the country go into which levels as opposed to deciding the overall framework, and there then to be a process of consultation about the application of that framework, I think that's probably what we will aim to do. Once we have an initial application of this framework, it will be something that is reviewed on a weekly basis, a bit like the international quarantine situation is just now, where we decide whether countries are coming in and out of quarantine. We would have the same situation for keeping the application of the tiers under review. So I think Parliament, it's really important that Parliament endorses the overall framework and the process that government will then go through to apply that process, as opposed to necessarily getting into the individual decisions about which country is in which tier, because that is something that I think government has to have the flexibility with a proper process to decide, and we also have to move quickly. But obviously, I will want to have discussions with the party leaders before coming to final views on that. Rachel Watson from the Daily Mail.
Thank you, First Minister. Just again on the tiered system, can you tell us a bit about how this will work with local areas? For example, will they be able to negotiate with you whether they move into a certain tier like we've seen in England? Will you be having those discussions with local authorities? And also, could different local authorities, for example, both be in the same tier but have different restrictions? So, for example, two areas could be in the exact same tier, but gyms could be open in one and not the other. Or would it be very kind of straightforward, this is the level that you're at and this is what will happen?
This is where, in the answer to the latter part of your question, this is where it is going to be so important for us to continue on an ongoing daily basis to communicate all of this to the public. What we're trying to do here is get greater certainty, but not deprive ourselves of all flexibility, because in the face of an infectious virus, that wouldn't be sensible to do. So we want to have, I suppose we want to minimise the scenario that you have described there, where two areas could be in the same tier but have different levels of restriction, because that kind of takes away from that level of certainty and predictability. But it's probably not sensible to rule that out completely, because there may be two areas in different tiers, two areas in the same tier, but the reason they're in the same tier is very different. One might be widespread community transmission and one might be a factory outbreak. So this is one of the difficult things, but important things. It's about to give as much certainty and predictability as we can, but also retain a degree of flexibility to allow us to respond to the virus as it develops. And the first part of your question, remind me what that was again?
Will you talk to local authorities?
Oh, yeah, sorry. And I don't mean this in any kind of pejorative sense. These are really difficult decisions, but it will be my driving ambition to avoid getting into the kind of situation that we see playing out with Manchester at the moment. And I don't mean that as a criticism on anybody in that situation. These are tough decisions. I believe it's really important for accountability, apart from anything else, that the buck for these difficult decisions stops here with me and the government. We're asking people to do extraordinary things right now, and it's not fair for me and the government to try to offload those decisions onto other people, whether that's local authorities or health boards. But we have to consult and be as collaborative as possible. So we will absolutely, we'll be engaging with local authorities. I mentioned earlier on the DFM's having an engagement with the political leadership of COSLA today about the development of the framework. And as we take decisions about which levels apply in which parts of the country, of course, we will want that to be as collaborative. There may be circumstances in which a local authority is coming to us and saying, could you put our area up a level because we're really worried about what's happening here. But ultimately, we have to be able to take the decisions. We're not in a position to get into the kind of standoffs over money. We will put forward in our strategic framework a system of support for businesses that are being required at any time to close or restrict their businesses. But we have finite resources, so we don't have the ability that the UK government has to kind of just pull out more money from the borrowing that they do. So we'll have to be very clear up front what that framework of financial support is. These are never easy decisions. What we're trying to do here is give as much clarity and certainty as we can, have as much collaboration and discussion with those that need to be involved in these decisions, not shy away from us being responsible and ultimately me being responsible and bearing the accountability for these decisions, and retaining a degree of flexibility in the face of an infectious virus. Nobody said it was easy, although I think we're all finding out just how hard it is. But that's the balance we're trying to strike. And as I say, the reason I continue with colleagues to stand here every day is just to try day by day to put into context and give the overall drivers of the particular decisions that we are arriving at. Richard Percival from the Daily Express is the last question.
Thank you, First Minister. I just want to ask what further discussions you've had with the UK government on, I know you wrote to Boris Johnson about the Four Nations approach. What have you had any discussions this week with him about maybe any potential travel or border restrictions? And also, if possible, I know this is more of a political point, but I just wanted to ask about it anyway. It was emerged last night that a document commissioned by the Westminster government sort of outlines the tactics to avoid a potential referendum after the Holyrood elections, and it sets out the issues that are facing Westminster because of an increase in support for yourself. I was wondering if you had a comment on that at all.
Comment on that here because this is a coronavirus briefing, and I think that is political. I will no doubt comment on that in other places, and my colleagues will comment on that, but I'm going to resist that temptation here. On the first part of your question, I had hoped we would have a Four Nations discussion this evening with Michael Gove around certainly the desire I have, and I know the Welsh Government has, to come to a Four Nations agreement on travel advice. That has been postponed, but I hope that will take place soon. I've not had any discussions over the last week or since the last COBRA meeting directly with Boris Johnson, but I hope that we'll have that discussion with Michael Gove sooner rather than later. That concludes the questions for today. Thank you to the journalists for them. Thanks to Anna for our BSL translation, to Shirley-Anne. The announcement Shirley-Anne made today, particularly about free school meals, is important. Guaranteeing free school meals for the forthcoming Christmas, February and Easter holidays next year, giving parents that certainty in advance, as well as the other announcement she made about additional funding for people in financial insecurity. These are really important aspects of our overall management of this pandemic, because it helps to recognise the impact that it has and the things we're doing to try to control the virus have on people who are already financially vulnerable. Obviously, we've shared a lot today about where we think we are with things, a lot of caveat and caution around any prediction that the restrictions that are in place right now are working. We continue to monitor that, but we know they will only have a chance of working if everybody sticks with them. So please remember to not go into other people's houses, work from home if you can, avoid car sharing. As Jason said earlier on, just try to minimise your interaction with people in other households as far as possible. And when you are out and about or interacting, wear your face covering, stay away from crowded places, wash your hands and hard surfaces, keep a 2 metre distance, and remember our key message today: self-isolate and get tested if you have symptoms. I will be back here tomorrow at 12:15 when I will update on Cabinet's decision about the current hospitality restrictions and say a little bit more about how we will move to this new tiered approach that you have been hearing us talk about, and obviously take any questions that there are at that time. Thanks for joining us today, and I'll see you tomorrow.